No problem. Thank you. And thank you so much for having me here today, especially during May, which is a very special time. And thank you for sharing all of those things that people can do to help raise awareness of EDS and HSD. So we'd love to see your hashtags, my EDS awareness challenge and my HSD challenge. That would be fantastic. My EDS challenge, my HSD challenge. And then we'll find you on social media. So I'm going to tell you a little bit today about the work that we're doing at the Ehlers-Danlos Society and some things that you can potentially get involved with. But I think the thing that I'd like to start with is talking to you about EDS ECHO. So EDS ECHO was inspired and started from Project ECHO, and that was launched because of hepatitis C by a doctor in America who realized that all of his patients were traveling long distances to go and see him, and his waiting lists were too long, and he realized that there was a better way to do things. And I think we can all relate and understand that, because so many of us don't know of where to turn to and what kind of doctor to see with their EDS and HSD symptoms. So he started something called Project ECHO, and the concept of it was to try and teach and educate and mentor other doctors that could look after patients with hepatitis C, because like EDS, there's no such thing as a hepatitis C expert. It needs to be looked after by lots of different doctors. And it's the same with EDS. There's no such thing as an EDS expert. You could be seen by a rheumatologist or a geneticist or a gastroenterologist or a neurologist. And so anyone can diagnose this condition. And it's just educating professionals so that they have the confidence and the resources to be able to do that. And so we were very, very inspired by what Professor Aurora was doing. And he had launched Project ECHO to be used across lots of different diseases and in lots of different countries, and it had been highly successful. So when we approached Project ECHO, we were actually the first rare disease to ever use Project ECHO, and I'm delighted to say it's been a huge success. Our target was to mentor 1,000 health professionals by the end of this year, and we are well on track to be able to do that. When we launched, we just had our one EDS ECHO. We now have echoes for pediatric management in Australia and in North America, and both of those cover the time zones all across the world. We have allied health professionals, again, Australia, UK, America, all the time zones being covered. Allied health covers all types of physical therapy, occupational therapy, etc. We have one for vascular EDS, which is fantastic. And we also have something that, again, was trailblazing and the first of its kind within ECHO, which is advocacy ECHO. And we realized how important it was to not only build our health professional army, but to build our patient expert army, because another way of educating the community, either, you know, society more broadly or health professionals, is to start with patients, because it's patients that are visiting the doctors that have access to all these different clinics and hospitals, and raising awareness in the right way is so key to helping advocate and to change things on a much more systemic level. So we introduced Advocacy ECHO, and it's been an absolute triumph. We've got hundreds of people on the waiting list, and we've had to roll out more and more programs to try and cater to the need. But it's been fantastic. Within that Advocacy ECHO, we mentor people with public speaking, research, raising awareness on social media, having broad knowledge and understanding of EDS and HSD, a whole range of symptoms that hopefully equip you and arm you with the skills needed to then raise awareness and advocate on a more professional level. And it doesn't need to have hundreds of people in a room to be able to do that. It can just be 1 to 5 to 10 people, and it can be local to where you are, and every little bit counts. So I do encourage everyone tuning in to check out Advocacy ECHO. You have to join the waiting list, but to take part in that, it's really been quite fantastic. So what else are we doing? Other than ECHO, we've been keeping very busy. And the one other thing I want to add about ECHO is the ethos and the the kind of tagline that they have, and that is all teach and all learn. And I think that just beautifully sums up the strength that comes through ECHO, that everyone is learning and teaching from each other. And I think that's essential. And as a society, we're constantly learning and hopefully teaching in the same way. So we always want to hear what is important to our community, what are the priorities, and try and echo that, excuse the pun, in all that we're doing. So when COVID-19 hit last year, I think everyone's lives were flipped upside down and we were approaching a new norm. And that new norm seems to have carried through not just for this first year, but I think it's going to be around for quite a while. And obviously one of the biggest things that impacted us were events. We had lots and lots of in-person events that we were looking forward to bringing the community together at. And we realized we had to pivot and evolve very, very quickly to this virtual demand that was there. Our patient community needed us more than ever. There were a lot of things that were frightening to people with learning about COVID-19. People needed support and people couldn't get access to their usual therapies and their doctors. So we needed to find a way to provide that. So the first thing that we did as a reaction to the pandemic was to increase the amount of virtual support groups that we have. And we found very quickly people were really wanting to attend that and speak of nothing else but COVID. And that was absolutely fine. That's what we wanted to provide the opportunity for people to do, ask questions. A lot of the times we didn't know the answers. It was a constantly evolving space where we were learning more and more about about COVID-19 and about what it meant to those living with chronic conditions. But we set up a COVID-19 specific webpage that had on it all the latest updates from the WHO, the CDC, the NHS, so that we could create one space where our community could just come and then see everything that there was out there, information as it evolved on the vaccine, as we knew it, publications that came out. But also we tapped into our professional community and said, right, how can we reach our patient community now that people aren't allowed to leave the house and are staying at home? And our allied health group came together in the most phenomenal way and started doing online courses, online videos, so that there was movement options there online for both adults and kids and teens. And that was just fantastic to witness. Of course, the other thing that we had to think about were our events coming up. So we had our big virtual summer conference planned in Arizona, and we really quickly realized that needed to be virtual. And it was actually amazing because we had over 1,600 people attend that event, our largest ever to date. And we translated it live into 5 different languages, reaching more people than ever. And I think we hit about 45 or 50 different countries, maybe even more. It was just phenomenal. And so we realized that going forward, even when we can be back in person, we always wanted to be able to offer that hybrid model so that people can either attend in person if they can, but also virtually and in all those different languages, because there are so many barriers that are there to people being able to attend in person, not just related to COVID, but, geographical, financial, health, all these barriers. And we want to rip those barriers down and make it accessible for anyone to be able to come and hear from these experts and learn. So this year, 2021, promises to be, I think, our biggest and most busiest year ever when it comes to events. We've already held a 2-day conference related to pain from a European perspective. We have conferences on neurology, allergy, and immunology. We have our big virtual summer conference, which is going to be fantastic. And all of these events are being translated into 5 different languages. So hopefully there is a language there that you can understand. We also have captioning that helps to understand the English. So we're really excited to bring these events to everybody and to just keep raising awareness and educating wherever we can. Of course, the other thing that was impacted was our hedge study. Many of you may have heard about Hedge. It was very, very exciting. We've had $2 million pledged to be able to try and find the genetic causes behind hypermobile EDS. And we say causes because we do think that there will be more than one gene. And of course, the whole process of Hedge was to try and enroll 1,000 people living with the condition. But of course, that was being done through our events. So when COVID hit, that was also impacted. But again, we didn't let that stop us. We just moved the model to a virtual enrollment, which again allowed us to enroll people from much broader geographical reach. And that was fantastic. So we've now almost enrolled 1,000 people into Hedge, which means the sequencing can begin, which means that then the analysis can begin. And then we can truly start to understand these things, publish the findings, and hopefully give a lot of people different answers. So I'm happy to answer any questions that people have about any of the programs that we're doing, about May awareness, or about any questions you may have for me. So I'm going to hand it back over to you. Thank you.
Thank you so much, Lara. I have a question for you. I'm just going to say this in Swedish. Skriv era frågor till Lara i Q&A. Och ni kan fråga om allting, antingen vad Society gör, om ni har några frågor till Lara personligen, eller frågor om ECHO till exempel, eller annat. Just translated about the questions. My question is, when do you think, you said the analysis is going to start and so on, but when do you think you're expecting and results?
I think it's going to be in the next 2 to 3 years. Yes. I think we're years away, but you never know. You know, there's not just Hedge going on. There's other research studies that have gone on that are already going to help support and complement Hedge, which may help us to find things out faster. Yeah. But I think ultimately we have to give this time. We've waited so long to do this. We do not want to rush it. And I don't think it's going to be straightforward that, oh, we have now our gene. I think it's going to potentially expand to there being lots of different types of EDS related to the phenotype. So when we know more about, you know, a genetic mutation, how does that impact? How do people present? What more research can we do to understand that? So I think I see this as the beginning and not the end. I think this is going to unravel lots more research and understanding.
I totally agree with you. Yeah, it's not going to be one gene. If it was one gene, I think that you would have found it already. But when, if the progress go as we wish to, what are you thinking about the gene testing? In Sweden here, it's very hard to get gene testing if you don't, if they don't suspect the vascular type. And we are trying to change that because all other 13 types of EDS is actually you can do screening for, but they don't do it. And the screening has gone down, price worthy also. What are your take on gene testing in the future?
So I think it definitely needs to improve globally. You're not the only country that shares that experience. And we hear from patients all the time who find that their doctors give financial restrictions as an excuse for not being able to do the testing. And I think that that is seen everywhere still, despite the costs going down. Now, as you alluded to, there are 14 types of EDS. We know the mutation for 13 of them, and yet still people aren't being offered tests, and they are more affordable. So will this automatically then lead to genetic testing? I'm not sure. I think what we want to move away from when it comes to hypermobile EDS, and what we're desperate for this gene discovery to help us with, is for it to remove the gray, for it to be black or white. You know, it's not up to a doctor to decide that they think it does or doesn't exist. You know, we know now it's real. We have enough evidence to show it's real, but it would be so much more helpful for there to be that simple genetic test that could tell people and help doctors as well. Now, with hypermobile EDS being the most prevalent type, and I think what takes up 95% of doctors' lists, if there was a test for that, I think you would see a massive increase in genetic testing, because it would just take away that kind of subjective viewpoint of is it not, is it HSD, is it another type, and also we need a lot more understanding between HSD and hypermobile EDS, and is that something that we're going to learn more about as time goes on? Is there a distinct difference? I think Hedge will help with that, but also the review of the criteria that's currently underway. So I do think this is a very exciting time, and I think the next 5 to 10 years is going to look very, very different, and I think that includes genetic testing.
It's going to be an exciting future. So we have some questions here. There's one question from Agneta, and she's wondering, how do I join the study of Hedge?
A good question. And I'm pleased to say it's all on our website. So if you go to our website and type in Hedge in the search field, or go under research or get involved, you'll see links and a way you have to join our registry and sign up. And then we will kind of decipher whether you meet the research criteria to then know if we can take you to the next stage. So all the information is on our website.
Yes, and let's see here. Any recommendations for us who want to do genetic testings? Companies, prices, latest research?
So I can't really point you in the right direction of companies. It's so different in different countries. I don't know for Sweden, in honesty, what the options are. But I think that you need to be careful with consumer testing that's done that you can just do online. I think the main reason being that often they're not completely reliable, and they give a lot of variants of unknown significance. And that doesn't mean that that's a pathogenic cause for disease. So even though you might have a variant of unknown significance on, you know, in the VEDS gene or classical gene, it doesn't mean you have VEDS or classical EDS. And I think that that's very hard for people to understand. So I would encourage you to only do genetic testing when it is ordered by a professional, where it can be interpreted by a professional, because otherwise it can be very frightening and confusing as well. But I think the best thing to do is speak to doctors and say to them, you know, if you're in a financial position where you can privately pay to do it, say, you know, I would like to privately fund some genetic testing, but I want it to be interpreted by a professional. There could be options there for you as well.
Yes, thank you. And is it possible to do an ECHO program in Sweden? I could volunteer, sorry, but yes, that's what. And there was another question. Any research being done on HSD, suspected genetic cause?
So 2 questions there.
Yeah,
I'll answer the first one about ECHO. Anyone can take part in ECHO. So we don't have country specific, we have regional specific ECHOs. And so if you mean advocacy as a patient, absolutely, you can sign up to do that. And sometimes we've worked with professionals who have contacted us that they would like to do a more localized ECHO in their area or in their discipline, and we're open to that as well. So if you have a health professional in Sweden that you think would like to start that, then by all means get them to reach out to us.
Yes, and then there was a question about HSD research.
Very good. Yes. So in terms of the gene, no, not specifically, but we do believe that the work being done in Hedge will benefit HSD as well. So I think it will be one of those consequences, another example of a consequence from Hedge.
And there is another question. It's in Swedish, so I'll try to translate it here. A simple question. If you can't take, one moment, Lara, I had to read it in Sweden. I have asked before, not you, but I think it's doctors, she applies, if you can take any supplements that strengthen the collagen.
So this is, again, not a straightforward question. In theory, if your collagen, if it is indeed collagen that is defective, and we don't know that yet, if your collagen is genetically impacted, then a collagen supplement will not change the genetic framework of your connective tissue. But we don't know the ins and outs. Now, I don't think it would harm anyone to take collagen supplements. And anecdotally, there are people who report that actually they feel much better when they do. Now, that could be a placebo effect, or it could be that we need to know more about why. You know, for example, we know vitamin C supplements improve people's pain and quality of life. And that could be related to the connective tissue aspect of it, because vitamin C helps, you know, bolster connective tissue. I think more broadly, much more research is needed into supplements and people taking them and the effects. And I hope that, you know, we can support that in some way in the future from people applying to research funding through the society.
Yes, and I have another question here about Awareness Month and how to take part. When you take part, you had the Walk and Roll Challenge, we had the Social Media Challenge, Fundraising Challenge, and then there's a Proclamation Challenge, but that is not really applicable in Sweden, I'm sorry. But how do you register to do the awareness acts? How do you do that?
So again, it's all on our website. You need to let us know the kind of things that you're doing, and then that there are incentives for each thing and for each amount. So go to our website under May Awareness, and all of the information is there. And we have got great feedback about the proclamations this year, that it's not very globally helpful, and in a lot of places in Europe it's just not a thing. And so we're actually spending a lot of time after May is finished looking at alternative options that can be done in Europe that are similar to the kind of more US focused proclamation challenge. So yeah, we have noted that.
I did the translation, although, but I tried to translate it to the Swedish system. So instead of the governor, we used what we call kommunfullmäktige. That is the municipal office, you can say, in every town, because I think even though we can't get like a proclamation, because we don't do that in Sweden, you can get some announcement anyway. So it's going, it can be adapted to yeah,
absolutely. Like in the UK, there's a process of write to your MP. Yeah. And so there's always things that can be done. We just need to do our global research to make sure it works for everyone. That's where the beauty of our affiliate program, where we work with colleagues such as yourself to help tell us what works in where you live, so that we can try and make it work for everyone.
That's great. Irene, did you have any questions?
No, I'm fine. Thank you.
Yeah. And I don't think we have any more questions. Oh, there is one in the chat. I'm not sure. Recommendations for good studies to read about HSD.
So I think the best paper that's been done about HSD is the 2017 paper. It's so new that there's not much out there. But if you go to our website, you can read a late version and the original version of the 2017 paper on HSD. And also, if you go to our website under research, there's a medical professionals directory. And if you type in HSD, it will bring up papers there that you can have a look at.
Yeah. Thank you. Any more questions for Lara? Write them now. No, I don't think so. But I would like to ask everybody, we're going to let you go on, Lara, with your busy schedule. We know you have a lot to do, but we're very thankful that you joined us today. But I would like to ask everybody to stay tuned in the webinar, and I will explain a little bit about what we are doing and how we are encouraging you to spread the ECHO, about the EDS ECHO program, to your doctor, and how you can do that.
Yeah. That would be fantastic. We're very grateful. The more people that can take part in ECHO, the more people that we can educate, which means more people can be diagnosed and cared for. So we're very grateful to you all sharing out that information as widely as possible.
Yeah. Yes. So thank you so much, Lara.
Thank you.
Thank you. And see you again in a year maybe.
Let's hope before. Bye-bye.
Yeah, bye. Så stanna kvar alla ni andra. Ska vi prata lite. Men nu hade vi ju Lara med oss ifrån England, som sagt, som pratar på engelska. Och var det någon som hade problem att förstå vad hon pratade om, så tänkte jag att jag skulle göra en liten snabb resumé. Först så började hon prata om ECHO. Och ECHO är ju ett program för läkare och andra professioner. De har ett echo för sjuksköterskor, ett echo för läkare, ett echo tror jag även för fysioterapeuter är på gång. Och sen finns det även ett echo för vad man kallar för advocacy. Och Irene, du kanske kan förklara lite grann vad det är, för du är ju faktiskt en advokat.
Det är jag faktiskt. Ja, det var 2019 var jag ju med på den utbildningen, och den gjordes ju den är ju på Zoom också som en kurs. Och jag vet inte hur många tillfällen det var, men jag skulle gissa att det kanske var 8 tillfällen under ett par månader. Och då lär man sig om grundläggande information om EDS och HSD och olika varianter där. Och man lär sig om hur man ska göra sin röst hörd. Hur man ska prata med andra för att kanske ha möjligheten att samla in pengar till forskningen. Och hur man ska nog stå upp för sig själv lite grann också. Men lagom mycket. Man måste ju lägga lite fokus också på andra. Så det handlar ju inte om att man ska berätta om sig själv. Det handlar om att man ska berätta om hur alla andra också har det. Så man är som en enhet med den här diagnoserna.
Du blir som en representant egentligen, kan man väl kalla det för EDS och HSD.
Patientföreträdare, tror jag det är på svenska.
Precis. Och om ni då skulle vilja signa upp eller anmäla er till det här, så kan man då gå in på Ehlers-Danlos Societys hemsida. Och det kanske du kan lägga upp vi har ingen chatt kanske. www.ehlers-danlos.com är det.
Jag skriver det här, det funkar.
Ja, och det var det första hon pratade om. Sen så pratade Lara lite grann om att de hade fått förändra väldigt mycket av sin verksamhet utifrån att covid-19 slog till eller dök upp för ett år sedan. Där de ganska snabbt gjorde supportgrupper, och det är lite samma sak som vi har. Vi har ju fikagrupper och tematräffar, eller fikaträffar och tematräffar som vi har. Och det är lite samma sak som Society gör, fast det är på engelska då, och det är människor med från hela världen. Och man behöver inte prata särskilt mycket om man är med på dem, utan man kan lyssna om man vill det, om man inte är bekväm i att prata engelska till exempel. Men det de gjorde då när covid kom, det var att de ganska snabbt började få ett fokus på de här träffarna som inte längre finns kvar. Kring det här med covid, för väldigt många ville prata om covid och förstå covid och hur det påverkade när man har EDS eller HSD. Och utifrån det så kom de fram till att de behövde ta fram bra information så bra de kunde. För eftersom covid är så nytt så är det ju ingen som har forskat någonting på det. Och att man också har lärt sig allt eftersom. All den informationen finns på deras hemsida, och den har vi faktiskt också översatt. Så att är man medlem hos oss, så var det med i vår senaste medlemstidning, det som står kring det. De har uppdaterat lite grann nu kring vaccinationer och vaccin och vad man säger kring det i samband med EDS och HSD. Och det sista det som Lara pratade om, det var deras konferenser. De har ju flera stycken digitala konferenser man kan vara med på. Det har varit en i år, eller har 2 faktiskt. Den första handlade om ett fokus på barn och hur diagnosen kan misstas för till exempel barnmisshandel eller missförhållande hemma och så vidare. Och vad man gör kring detta för att liksom försöka sprida den kunskapen att man får blåmärken lättare och så vidare just när det kommer till barnfokuset. Och den andra som var här nu för några veckor sedan handlar om smärta. Och framöver kommer det att komma både kring allergier som hon pratade om, eller immunologi som det så fint heter, och det kommer även att vara kring neurologiska problem. Det är också nu här ganska snart en kring de sällsyntare typerna. Så att om man har någon utav alla de här andra, alltså A, D, M, E, alltså det finns ju jättemånga olika sorter, men de riktigt sällsynta typerna, så är det en konferens här i månadsslutet kring det, och sen kommer det en som har fokus på vaskulär EDS också här innan sommaren. Och sen är det då den stora sommarkonferensen. Så det pratade hon också om. Men nu tänkte vi prata lite om vad vi ifrån EDS HSD-föreningen vill be er om hjälp om idag. För att vi tycker ju det här med ECHO är fantastiskt. Det är alltså ett program där, nu säger jag läkare även om det är andra professioner också, så att ha med er det att det är även sjuksköterskor och det är även fysioterapeuter och så vidare. Men de går inte samma program. Utan det vi tänkte fokusera på idag är programmet för kanske läkare då. Och det är alltså så att det är helt kostnadsfritt. Så att när man går med i det så är det, tror jag, vid 8 tillfällen, det kanske är fler nu tidigare. Det har sett lite olika ut, men det är i alla fall ganska många tillfällen. Och varje tillfälle tar upp en särskild del inom EDS och även samsjukligheten. Så första tillfället är ju liksom, vad är EDS och hur diagnostiserar man? Och sen så är det allt ifrån mage till neurologiska problem till, så att det är liksom massa olika fokus, och det leds av de världsledande experterna som kan absolut bäst om detta. Men ytterligare en grej som är väldigt bra, det är att de som går i det här får ett nätverk utav andra läkare runt om. Så när man har någonting som man inte riktigt vet, där man tänker, vad ska jag göra här? Hur ska det här behandlas? Eller hur ska jag tänka när det kommer till det här? Om jag ger den här medicinen så påverkar det samtidigt dysautonomin. Hur ska jag tänka i detta som läkare då? Då har man ett helt gäng med kollegor som man kan rådfråga. Och man kan även presentera patientfall anonymiserade. Så att det är ett fantastiskt sätt att sprida kunskapen i våran vård. Men vi har inte jättemånga svenska läkare ännu som har upptäckt det här. Och det vill vi ändra på. Så vi har tagit fram en särskild informationslapp, kan man säga. Jag kallar det för lapp. Jag vet inte om man, nu för tiden finns det säkert något finare namn än lapp. Men en lapp helt enkelt som man kan trycka ut hemma själv. Den består av 2 sidor. På den ena sidan så står det om vad är EDS och vad är HSD. Ganska kort men koncist förklarat för dem. Det finns också med länkar till våra svenska vårdprogrammet och till den svenska kliniska kunskapsstödet. På sida 2 står det om ECHO och hur man kan gå med där och vad programmet innehåller på svenska. Och sen så finns det även där då med länkar så att man kan som läkare läsa mera kring det hela. Så vi vill be er allihopa om hjälp. Vi kommer att skicka ut den här lappen till er som har varit med idag. Vi kommer att skicka ut den till alla våra medlemmar och vi kommer också lägga upp på våra sociala medier att man kan be om att få den utav oss. Så vi hoppas att så många som möjligt utav er vill ta med den här till sin läkare och uppmuntra hen att gå på ECHO. Det bästa som kunde hända är att det blir kö hos ECHO helt enkelt. Så att, för vi tror att om vi gör på detta sättet så kommer vi att kunna sprida kunskapen och den riktiga kunskapen, den korrekta kunskapen. För att det är liksom från de absolut bästa i världen som vet absolut mest av den senaste forskningen som håller i de här utbildningarna. Så vi vill be er att hjälpa oss att ta med en sådan till er läkare nu under maj helt enkelt. Och skulle man inte ha ett läkarbesök i maj så går det lika bra att ta med den i augusti eller september. Det är helt okej. Så att, ja, det var väl lite grann. Ska vi se om vi har fått någon mer fråga. Nej, ska vi se. Hanna skrev att det var fantastiskt och I'm in. Det är jättebra Hanna, tack för det. Vi kommer som sagt att mejla ut den här till er så att ni allihopa har möjlighet att göra detta och det är på svenska. Så att jag skulle vilja säga att nu finns det längre ingen ursäkt för en läkare att säga att det där vet jag ingenting om. Därför att han eller hon kan få lära sig någonting om det och väldigt enkelt och gratis.
Sen så är det väl också så att jag för mig att det brukar vara på lunchtid så att man ska kunna delta även på lunchrasten då om det är så att läkarna känner sig villiga att göra det.
Ja, precis. Tidigare i alla fall, de tidigare ECHO som har legat, eller som har gått då de har en i USA och en i Europa. Då har de lagt det på lunchtid just så att stressade läkare ska kunna sitta och äta sin mat samtidigt och ändå vara med, helt enkelt. Så man ska kunna göra det också på arbetstid. Så jag tänkte, är det någon som har några frågor till oss kring någonting? Det är bara att skriva i Q&A, någonting som var otydligt, något annat. Ni undrar över vad vi gör, det är helt okej. Alla frågor är välkomna. Vi kan väl också tipsa om, lite det började jag väl med, men för er som kanske kom in lite sent så kan vi tipsa om att på onsdag så har vi Erik Ronge med oss, känd i EDS-sammanhang läkare, som kommer att berätta om samsjuklighet med mage och tarm i fokus. Så att då kommer och sen kommer även Erik tillbaka lite senare med att svara på frågor. Det har ju varit väldigt populärt, framförallt brukar vi ha väldigt mycket frågor när Erik är kvar. Så att ja, då kommer vi ha en frågestund med Erik också. Jag ser inga frågor i Q&A. Så då tror jag att allting har varit ganska... Vi har varit tydliga helt enkelt. Och vi hoppas att ni som sagt var allihopa hjälper oss nu. Och berätta gärna på sociala medier eller för vänner och så vidare om ECHO. Och att man kan hjälpa till och sprida kunskap kring det hela. Vi ska se här, många läkare jag träffar hänvisar till att Socialstyrelsen, och sen stod det ingenting mer, men jag gissar att du menar att de hänvisar till att Socialstyrelsen information om EDS och att inte EDS finns med där längre, och det är ju helt rätt att det är så, att den finns inte med där längre. Däremot kan man då istället och hänvisa till SKR, Statens kommuner och regioner, och där finns det kliniska kunskapsstödet för EDS och HSD. Så att som sagt var, på Socialstyrelsen, de har liksom bara i uppdrag kring att då uppläsa kring sällsynta diagnoser, det är deras uppdrag där. Så att det är därför egentligen. Men som sagt, vad skulle en läkare avfärda med att det står någonting på Socialstyrelsen, så hänvisar då till SKR för att de lyder under statens kommuner och regioner också. Så det är väl vårt tips. Då så säger vi tusen tack för idag och hoppas att vi ses allihopa på onsdag.